the Farokh disease, Hahnemann has mentioned the degrees in series. Right? The basic problem is that we don't read our literature. So Hahnemann has clearly mentioned series in degrees. What is that? You prescribe 6, 9, 12, 15, 18, 24, 26, 30. And likely you can also prescribe 30, 26, 22, 18, 12, 9, 6. So there is no confusion at all that high potency will, what do you say? Antidote, lower potency. No, never. Every potency has its own field. Every potency has its own field on particular organs and particular state of the body and mind also, not only body. We treat not the physical part, we also treat the spiritual part, the vital force. We actually treat the vital force, right? So once your sickness is in the higher strata, you need higher potency. The sickness is lower strata, you need lower potency. And side by side, I have given so many cases at the same time, 6, 30, 200. And it works. In the morning I told you nothing is anemical. Just I am little. Sir, may I ask a question?
पूछिए.
Sir, the 1x 5 drops 10 drops that I have read and various authors are also use that. But I have never tried this 10m 3 drops 6 hourly. So this concept is new for me. Please elaborate. Thank you.
So basically, we had a very brilliant homeopath 50 years back in Bombay, known as Dr. Bhanu Desai. Bhanu Desai. Bhanu Desai was from Calcutta. He was a DMS. Bhanu Desai wrote a book on coma. Very small booklet, 20 pages booklet.
Bhanu Desai?
Yeah, in which he gave cases and there he showed efficacy of CM, 10m and 50m potency given repeatedly. Now in those days it was considered a sin if you give this. Bhanu Desai used to give this. Bhanu Desai had a disciple, Dr. Sarabhai Kapadia. Dr. Sarabhai Kapadia was my mentor, my guru. Dr. Sarabhai Kapadia assisted him for about 2.5, 3 years in his private clinic. He used to give phosphorus CM in an open case of tuberculosis every 2 hours. He used to change medicine 4 times a day. I still remember there was a farmer from Gujarat who had a massive cavity in the lung with tuberculosis. Doctor had given him the hopes, he'll die. You know, in those days. Now I'm taking you to 81 to 85, 1981 to 85, when I was helping Dr. Sarabhai Kapadia. And he gave phosphorus CM because he was vomiting blood. Then he changed it to Echinacea indica CM. Then in the night he gives Syphilinum CM. In 48 hours the bleeding stopped. Now if I tell this to those homeopaths in that time, people either will laugh or will get angry or will go for a street fight with me. Correct? Sarabhai Kapadia used to cure patients with high potencies repeatedly. I developed a lot of courage from Dr. Sarabhai Kapadia. He was a very big friend of Dr. M.L. Dhavle at that time. And there was always a fighting between M.L. Dhavle and Sarabhai Kapadia about high potency and frequent repetition. Because Dr. Dhavle used to give 10m, 1 dose, 2 dose, 3 dose maximum. This guy used to give 2 hourly CM. Of course, we had Dr. Rashid Wadia later on in Bombay also who gave CM. Every patient who came, he started with 10m, 50m, CM. And so, when I started my own private practice, I did not want to blindly follow Bhanu Desai. I did not want to blindly follow anybody. I wanted to make my own way through my own experience. So when situation demands, I do that. When situation does not demand, I give low potency, medium potency. But when I went to Vasilis Gigas, he told me that the strategy of CM, 10M, one dose followed by the same low potency gets a speedier recovery of the patient. He is a medical doctor. Dr. Vitulkas learned a lot from Vasilis Gigas. You know, Vitulkas is a layman, he is not a doctor.
Sir, my question was not that. My question was the 5 drops or 3 drops of 10M. So, my question was not the potency.
Yeah.
My question was the quantity of the dose.
Yeah, okay.
Yeah.
So what happens is that in hospital patients, basically we have no control of the drops because nurse is going to give. Wife is not allowed in the ICU. You saw that he was on a surgical bed. And that is why many times there are tubes in the mouth. Many times there is an oxygen thing in the mouth. So ideally I say 10 to 20 drops. Now how many drops the nurse gives, God only knows.
Sir, my question is not that. I need the rest. We usually give 10M or CM frequently in 5 minutes in our hospital. It's every day. Not a problem. Potency is not a problem. My problem is that I use one globule number 10 mixed in 100 ml water, then from various cups. But here you mentioned 4 drops of 10M 6 hourly.
They will not do it. No, in my private clinic we use 5 cup method. Correct? You know the method.
Okay. Yeah.
But hospital people will not do all those things.
In your method, so the first cup, how much medicine quantity?
One pill.
1 pill. Okay. So this was a rare example. That
All hospital cases we cannot do 5 cup. So either we go for an inhalation technique, or we go for the local application technique.
Yes, we do a local application.
Or we do multiple drops.
Yeah.
There we have a handicap because we are at the mercy of nurse and the consultant. Many times the nurse will not even give 2 hours.
Is there any reference in the books to give 5 drops?
No. It's arbitrary. Total arbitrary.
Okay, that's my question. I want to know
total arbitrary.
the source.
But I tell you, I have learned this field of posology from different doctors in different ways, and somehow all the doctors from whom I have learned have been a very successful practitioner of homeopathy. When I went to Dr. Dubey, I assisted Dr. Dubey in Calcutta. I assisted Dr. Bholanath Chakravarti in Calcutta. Both these people were using plussing method of NM with a great success. Great success. So when I went to Calcutta, I gave up high potencies of Sarabai and totally followed Calcutta School of Medicine with plussing method. When I came back to Bombay, we had an alcohol problem. Drug inspector will come, you have to apply for an alcohol permit, then he will come and see where you are storing alcohol in your clinic. If the bottle is on the ground, they charge you 5,000 fine and this and that. I said, to hell with the alcohol, I threw it out from the window. I said, I will only make medicine from distilled water. And that's how I invented 5-cup method. You can see the video on the YouTube. I don't use alcohol at all. So there is no plussing method. But the method of plussing method is there in my 5-cup method. And so I either pull 1 drop or 1 pill in the first cup and we start making 5-cup method. In that way, if you buy a Lachesis bottle of 1 gram, it will last me for 5-6 years. So investment cost is also very low. You don't spend much money on that. And Dr. Kopikar, a very brilliant man living in Sarojini Nagar in Tamil Nadu, has written a very nice book in which he says medicine, even if it becomes brown, dark brown or black, I have seen best results with that. So if my pills also become brown or they stick to each other,
It works.
don't tell people, but I sometimes use ball pen to remove that sticker. And then I use it, it X. Off the record. You understood? So it X. So उससे अच्छा क्या चाहिए और